There's a peptide out there right now that can make a rat's torn Achilles heel stronger than it was before the injury. It can rebuild muscle after trauma. It can protect organs from damage. And it can keep blood vessels alive during stress. That would normally kill tissue. Athletes are whispering about it in locker rooms. Anti doping agencies such as WADA have already banned it, and your doctor is probably still calling it not standard of care. It's called BPC 157 or BPC 157, tomato, tomato. If you've spent any time on the mats or in the peptide rabbit hole, you've heard the rumors. I'm going to show you what this peptide actually does in the lab, where the internet hype completely outruns the human data, and exactly how I think about using it for joints, tissue, health span, and longevity without violating the cardinal rule of medicine, which is to do no harm. I'm Dr. Justin Kernut. This is Proof Mode Health. Let's look at the evidence.
First, let's validate the hype, because unlike a lot of supplements I roast on this channel, this isn't just Instagram fairy dust. BPC 157 stands for Body Protection Compound. It's a 15 amino acid peptide derived from a protein actually found in your stomach. It was isolated back in the early 90s by researchers in Croatia. Since then, we have what reviews call robust regenerative effects in animal models. We're talking muscle, tendon, ligament, bone, gut, liver, heart, and nerves. In rodent studies, when you surgically cut an Achilles tendon and give BPC 157, it doesn't just heal, it heals with better structural integrity and a higher load to failure point. That means it takes more force to snap it again, compared to natural healing alone. Even more interesting, there was a small human series where 7 out of 12 patients with chronic knee pain reported over 6 months of relief after a single injection. So, is it doing something? Yes. In animals and early orthopedics, BPC 157 is absolutely doing something. But how does it work? This is the part where most people, especially internet bros, get it totally wrong. It's not magic, it's mechanics. Think of BPC 157 as a construction foreman at an injury site. Mechanism 1, the plumbing upgrade. It triggers something called angiogenesis, the growth of new blood vessels. Specifically, it upregulates a receptor called VEGFR2 and activates the nitric oxide pathway. In plain English, it tells your body to grow new capillaries into the injured area. You can't rebuild a house if the delivery trucks can't get to the driveway. BPC 157 builds the roads. Mechanism 2, the scaffolding. It activates something called the FAK pathway, focal adhesion kinase, which controls how your cells move, adhere, and organize during repair. In tendon models specifically, this leads to better tendon-to-bone integration and prevents messy scarring. Mechanism 3, the fire department. It reduces pro-inflammatory signaling. It doesn't erase inflammation. Inflammation is necessary for healing, but it calms the chemical fire so the repair crew can actually work. So mechanistically, BPC 157 is not a painkiller. It calls in blood flow. It organizes the crew. It puts out the fire. Then it gets out of the way so your body can finish the job. That's the foreman at work. If you only read the animal data, you'd think Marvel Comics wrote this peptide. Faster healing in fractures, muscle tears, and ligament injuries. In fact, this evidence is strong enough that the World Anti-Doping Agency, WADA, actually banned it because it works well enough to be considered an unfair advantage. The gut, this is actually where it shines brightest in the preclinical data. Healing ulcers, colitis, and gut injury. It protects the stomach lining, like armor. Brain. There's even data showing protection in traumatic brain injury and nerve damage models. But, and this is a massive but, we do not live in rat world. We live in the real world. And that's where the risk comes in. Here's the sober truth that most influencers won't tell you. When someone tells you BPC 157 is proven to extend your lifespan or cure every disease, that's not science. That's fan fiction. Fact 1. The human data is incredibly thin. We have mountains of rat and mouse data. We have very, very little high-quality human data. Most of what we know in humans comes from anecdotes and small, non-randomized observations. Fact 2. The regulatory gray zone. BPC 157 is not FDA approved. You're buying this from research chemical sites or compounding pharmacies. Quality control is the Wild West. Is what's in the vial actually 99% pure? Or is it 80% pure with 20% unknown filler? Fact 3. The cancer question. Because BPC 157 grows new blood vessels, angiogenesis, there's a theoretical risk that it could help existing tumors grow faster. We haven't seen this in the safety data yet. The safety margins look huge in animals, but we simply do not have long-term human studies to say zero risk. So, the correct label for BPC 157 right now is insanely promising, still unproven. Proceed with caution. Okay, knowing all that, how do I actually think about this in practice? I'm a pharmacist. I'm not your doctor. This is education, not medical advice. But here's my personal jujitsu logic for navigating BPC 157. Who is this for? In my world, this is for the person with a chronic tendon or joint issue where the MRI says nothing to operate on, but the pain is stopping you from training, or the post-surgery phase, where tissue quality is everything. If my knee hurts, I want the peptide near my knee. I lean toward injectable protocols for joints, subcutaneous or periarticular, administered by someone who knows what they're doing. If I'm trying to fix gut health, I look at oral formulations like BPC 157 arginate, which survives stomach acid better and has a mechanistic reason to work orally. The parking brake rule. The way I see it, BPC 157 is not a bailout for bad training or terrible sleep. If you're sleeping 4 hours a night and eating trash, BPC 157 is a waste of money. It's the accelerator you hit after you've taken the parking brake off. Fix your sleep first. Fix your rehab first. Fix your nutrition first. Then maybe add the fuel. The time window. I view BPC 157 as a cycle, not a lifestyle. 4 to 8 weeks to address a specific problem, then reassess and get off. Not forever daily, not a cosmetic daily supplement. A targeted repair tool. And in some cases, bigger injuries, post-surgery, or stubborn tissue issues, I've seen better results stacking BPC 157 with TB 500. Or even a 3-stack with GHKCU. But that's advanced tier. That's after you've already proven the basics work. Before you even think about buying a vial, run this checklist. Red flag. Number 1, the forever pitch. Anyone telling you to stay on BPC 157 for life? Run away. I view this as a cycle, 4 to 8 weeks, then get off. Red flag number 2, no third-party testing. Research-only sites with no COAs, certificates of analysis, visible on the page. If they won't show you the purity test, you don't know what you're getting. Red flag number 3, the cure-all promise. If they say it cures depression, cancer, baldness, and aging all at once, they're lying to you. BPC 157 is powerful, but it's not magic. Red flag number 4, no medical supervision. If you're using injectable BPC 157, you want it sourced from a reputable compounding pharmacy or through a clinician who's actually managed cases before. The bottom line, powerful tools in the wrong hands become toys. I'm not interested in toys. I'm interested in longevity.
If this helped you see BPC 157 through both lenses, the this is crazy promising lens and the sober science lens, do me a favor. Hit like, subscribe, and send this to the most beat up grappler or elderly person that's falling apart or younger person that's falling apart that you know. They probably need it. And if you want my personal breakdown, how I think about stacking this BPC 157 with TB 500, timing it around your training blocks, physical therapy, or surgeries, and the exact questions I'd ask a provider, and the safety checklists I use, especially in vetting a product, drop the word BPC Blueprint in the comments below. I'll get that resource pack into your hands. I'm Dr. Justin Kernut. This is Proof Mode Health. Do no harm, heal on purpose, and I'll catch you in the next one.